Again, we're not doing a good job, I think. HIV is being insufficiently addressed. So we are not yet realizing the goal of integrated services in permanent supportive housing, at least in Los Angeles, at least based on these data so far. So first, I want to pose a question that I think has a very obvious answer, and that why would we consider HIV and HIV prevention among people who are experiencing homelessness? Well, it's an obvious answer because as Julian Castro mentioned this morning in his video, we know that prevalence rates or the risk associated with HIV increase considerably for persons who are experiencing homelessness. And studies from coast to coast have demonstrated incontrovertibly the high rates of HIV infection among homeless persons. So it is epidemic. And we know based on, for example, a CDC-sponsored study that was published this year that across 23 cities in the United States, the two strong predictors of HIV prevalence were poverty level and homelessness status in cities. And we know that AIDS is increasingly a disease of indigent persons. We don't know very much about prevention services among persons experiencing homelessness. There is not very much in the way of prevention services for people experiencing homelessness. Access to all services, particularly prevention, is quite difficult for someone who is experiencing homelessness. And as for PrEP, well, let me give you a sense of what's to come. I've been asked particularly to talk about PrEP, and I will focus on that today. This is a perspective on PrEP from sexually active homeless individuals, men in Skid Row. One of my former doctoral students based his dissertation on this topic. Men have never heard of it. Men in Skid Row have never heard of it, but they're really excited about the potential for protection. But where do you get it? No one's ever talked with them about this. And there's recognition, there's a context around that statement, you ain't going to get that here, in that there is recognition of the systemic racism and classism that affects this population and that makes it very difficult for them to access effective care. So clearly, when we talk about individual risk for HIV, this discussion, this acknowledgement must be framed in terms of overarching structural factors. And we've talked about that yesterday. It's an overarching theme of this conference. We have to talk about services, policies, systems, and yes, housing. Housing is health care, housing is prevention. But if housing is health care, then perhaps I'm going to pose a question that has a less obvious answer. And that is, why then do we care so much about, or why do I care so much about HIV prevention once people transition into permanent supportive housing? Why does that continue to be an issue? Well, much of what we know about the relationship between HIV risk and housing stability or instability and quality from researchers like Dr. Adela, who presented yesterday, is based on people living with HIV, people living with HIV/AIDS, people who are HIV positive. We don't know very much about risk and how HIV risk and prevention behaviors change over time once homeless individuals who are not necessarily HIV positive transition into permanent supportive housing. We don't know what the mechanisms are when risk behaviors change. Why do they change? What is it about housing that facilitates that change? If we know, we could do better in providing that. And what do we know about access to HIV prevention over time in permanent supportive housing? One thing I want to point out is that for all the focus we must place on integrated health care, I believe, and on health homes for individuals who are in permanent supportive housing, HIV prevention has not been part of that discussion sufficiently. We haven't sufficiently considered HIV prevention as part of integrated health and behavioral health care, and I think that needs to change. And so we need really a multi-pronged effort, and I have a long list of things that I think we should do based on the data thus far. One of the most important, I think, is empowering the consumers. Every person experiencing homelessness has a right to know what he or she is entitled to. And there's some very strong advocacy groups like the LA Community Action Network that works on issues just like that. I don't know if they have ventured into the area of HIV access, but maybe that's a conversation to have. And for the providers, enhancing awareness and training on HIV prevention throughout the network, education on what the policies are, what is happening in LA regarding PrEP. There's a lack of awareness. That information hasn't been sufficiently communicated to providers. We would like that idea of joint responsibility throughout the integrated care team for HIV prevention services. It shouldn't just fall to one person. We need appropriate training, and we would like an easy, no questions asked access policy to condoms whenever anybody wants them. And now I want to go into structural changes. We need additional high-quality permanent supportive housing. We absolutely need more, and that's probably true across the country. And I would like to see a mandate on further development in Los Angeles that would require developers to set aside a portion of their units for lower income residents. And that could be achieved through a combination of incentives as well as disincentives for lack of compliance. And a system of support for permanent supportive housing providers, many of whom are really just embarking on this venture anew. This is new in Los Angeles. So people have had to sort of retool to provide permanent supportive housing, whereas maybe they were focusing on shelter before. So these providers are earnest in their intentions, but they need some help, I think, to do it in the way they'd like. And we also need to reduce NIMBYism. We have a situation, this is a big list, this is my wish list. We have a situation certainly in Los Angeles where only a few communities are taking responsibility for homelessness, and primarily that's the Skid Row area downtown. But people are homeless all over our city, and every citizen needs to share responsibility. And perhaps if we would educate the public on what homelessness results from, it could be your sister, it could be your brother. This is not a social pariah issue. And if we could educate people on the cost effectiveness of housing, which others have done so well, and that's why permanent supportive housing is a part of HUD's platform, because we've demonstrated the cost effectiveness. And also, I just want to emphasize again the importance of each one of us taking responsibility for our brothers and sisters in our communities.